to also answer questions today. I'd like to do two things. I'd like to first start by providing some additional updates on the presumptive positive case that we discussed yesterday. I'd also like to provide a little bit more information on one of the cases we issued a press release about this morning. Let's first start with the individual that we reported as presumptively positive yesterday. Since that announcement, the team of epidemiologists at the Maine Center for Disease Control and Prevention has made contact with this individual and had a series of discussions to determine where this individual has traveled, and what contacts she has had since returning to the United States. I'd like to first note that this individual has been a model citizen, and we commend her for her cooperation throughout this process. The individual recently returned from travel to Italy, and immediately upon re-entering the United States, as soon as this individual began feeling symptoms, ensured that she stayed indoors. We discussed with her the contacts that she had had. Fortunately, those contacts were minimal, and Maine CDC has reached out to all of them to discuss what levels and precautionary measures they need to take, if any. The individual continues to do well. She has not been hospitalized. We remain in contact with her, and one of our top priorities right now is to work with her to ensure her a speedy recovery. I'd also like to provide an update on one of the two cases that we released and discussed this morning. Maine CDC is able to now confirm or announce a second presumptive positive case of COVID-19 in the state of Maine. This is a male in his 50s who is a resident of Cumberland County. As with where we were 24 hours ago, our epidemiological investigation is already underway. When more information becomes known throughout the course of that investigation, we will update everyone immediately. I'd also like to provide a little bit of clarity on a few things. The first, once again, is to go over the terminology behind presumptive positive. As of right now, the United States Center for Disease Control requires all tests that are done that are returned as positive at the state level to be sent to Atlanta for confirmation. That's why we are reporting this second case, as well as yesterday's case, as presumptive positives. When the US CDC laboratory in Atlanta confirms those, we will then change our reporting and report those as positive confirmed cases. I'd also like to provide a little bit more clarity on testing overall. Testing is done at the direction of a physician in the state of Maine. The Maine CDC does not stand in between a physician, his or her clinical judgment, and their patient. If a physician determines that an individual patient warrants or requires testing, the physician is urged to fill out the forms for Maine CDC's laboratory, which contain directions on how to take the sample and how to send the sample to us for testing. We ask anyone who has symptoms, who is not feeling well, and believes that they may have coronavirus or COVID-19, to ask your provider for testing. If you do not have a provider, we urge folks to reach out to an urgent care facility. We do not recommend that you go to the ER. We ask that you call your doctor's office or an urgent care facility first. There's also been a bit of discussion that I'd like to clarify between tests and test kits. Test kits are what laboratories like our laboratory here at Maine CDC acquire from the US CDC. Those kits contain different types of chemicals and DNA samples that allow our laboratory to run tests around the corner. Maine CDC currently has one test kit, which we anticipate will allow us to run approximately 1,000 tests. Thus far, we have completed approximately 91 tests, so we've got about 900 or so in the test kit remaining. While I'm on that topic, as of right now, Maine CDC's laboratory has conducted a number of tests. There have been 91 negatives, 2 that are presumptively positive, and as of just a little while ago, approximately 17 that are pending. As we continue to see increases, now 2 presumptively positive tests in Maine, as well as increases of coronavirus disease across the Northeast, indeed across the country, I'd like to take a moment to speak with older Maine people and those who have chronic health conditions. I'd like to ask those folks to do 2 things. The first is to begin preparing for the possibility that there will be more coronavirus cases in Maine. That includes making sure you have adequate supplies in your household, making sure, for example, you have a long enough supply of prescription medications. If you need to be quarantined at some point for 2 weeks, please make sure you have a sufficient supply of medicine so that in case you are not able to get medicines from somebody else, you can be able to have a steady supply during the quarantine period. If you live with somebody, a friend or a family member, who is older or has chronic medical conditions, please make sure that they are also ready. Yesterday, we talked at length with Governor Mills about social distancing and the governor's recommendation that all large, non-essential indoor gatherings of greater than 250 people be suspended. But social distancing does not necessarily occur just in large gatherings. Each of us can practice social distancing at different ways in our lives, and we urge everyone to do so. But we also recognize that other things can result from social distancing, like loneliness. So what I'm urging everyone today to do is to practice social distancing, but not social isolation. Nobody knows how long the COVID-19 situation will carry, but we have to make sure that as it goes on, although we are taking steps to distance ourselves from others who may be ill, we're not isolating ourselves from society. As I said yesterday, and I'd like to repeat today, my ask for all Maine people is to be kind and take care of your neighbors. So with that, I'd like to turn things over to Dr. Dora Mills for any comments and questions.
Thank you very much, Dr. Shaw. And I just want to say on behalf of Maine Health that we are been working on getting prepared for this in many ways for years. And it's been a great delight to work very closely with Dr. Shaw and the Maine CDC, who has been really stepping up to the table in a very big way and helping not only Maine Health, but all healthcare providers across the state. Maine CDC, particularly Dr. Shaw, has been in close touch with healthcare providers from Maine Health, Central Maine Healthcare, Northern Light Healthcare, Maine General, our federally qualified health centers, and many, many other health providers. And we greatly, I speak, I think, on behalf of all of them, that we greatly appreciate his leadership and Maine CDC's leadership in providing us the information we need and the direction we need as this rapidly evolving situation unfolds before us. I am here because one of the presumptive positive patients is a Maine Health patient. So we're also here to answer any questions people have on that. And so if there's any questions or anything, but thank you.
So is that the third case?
Do you want to speak to them?
Sure. So right now, there are 2 presumptive positive cases in Maine. that's all we're reporting right now in terms of the official case count.
But the press release this morning said there were 3, so can you clarify?
Sure, sure. The additional individual, we're still reviewing their test results, and when we've completed our review, we will either label that case a presumptive positive, or depending on what our review yields, we'll go from there.
How long does it take the CDC in Atlanta to confirm the presumptive positives? And secondly, you said doctors here who do the screening fill out a form for the testing. Do you then have to approve the test? I wasn't clear on that.
I'm going to take those in reverse order. Maine CDC does not approve the tests. We are not a gatekeeper. If a physician believes that a patient needs to be tested for COVID-19, that is a clinical judgment that is up to them. It is on the order of that physician that we conduct the test. We don't have independent testing authority. We rely on the doctor's testing authority. US CDC, their turnaround time, based on my conversations with counterparts in other states, their turnaround time to return a positive result to us is on the order of several days right now.
There have been modelings that up to 160 million Americans could potentially be infected by this. Has Maine CDC modeled how this could spread in the state? And do you have projections on how many people could potentially be infected in, a week, a month, things like that?
Yep, I'm familiar with many of those different models, and as you're aware, every model is based on the assumptions that go into it. Some models project higher numbers of people across the country, across the globe, that could potentially be affected. Others, making different assumptions, arrive at different scenarios. What we've started to do, and have been doing for quite some time now, is taking a look at our demographics to get a sense of what our numbers are for individuals who might be at risk, and then using different assumptions based on how many individuals are infected after being exposed, and then how many individuals who are infected after being exposed become severely ill, and then what fraction of those require subsequent care. That's how we're doing our planning right now. There are multiple different scenarios. I'd like to just stress, there is not one model we are relying on. In planning exercises of this sort, you start with a variety of different assumptions, some that produce the most conservative numbers, others that produce the most extreme numbers, and we plan for scenarios for each of those.
Are you able to share some of those projections with us?
We can show you the numbers that we're using in order to arrive at them. The projections just take different percentages for each of those. So there's no magic behind that. We just take a look at the number of individuals, say, who are over a certain age group in Maine, and then speculate, we don't speculate, but if a certain percentage of them were exposed, how many would expect it to be infected, and then based on data from the World Health Organization, how many of those may require hospitalization, et cetera. So it's less a model and more just a stepwise progression. Yes.
We're hearing reports of the availability of tests. I'm asking about that. We're hearing reports that there are some people who are having to wait to get tested, and also what about the new testing procedures? Nordex, are they helping out now as well with the testing?
So I'm going to have Dr. Mills start us off.
That's fine.
Yes, Maine Health's laboratory, Nordics Labs, did start testing a couple of days ago. And this is in order to help expand our capacity in the state. So with the state, Maine CDC's laboratory, as well as Nordics laboratories, we hope over the next few days that we'll have parallel labs and being able to work to make sure that anybody who needs a test can get a test. Now, there are other blocks in the system, I should say, or it's not just the availability of the test, but when you go and get a test, it is not for COVID-19. It is not just a matter of getting a swab like you do for a strep test. It's a different type of test. So you have to have a swab that goes down into the back of your nose and one that goes down to the back of your throat. And because they are being tested for COVID-19, the provider, the professional who is taking the test, must be outfitted in basically head to toe almost, what we call personal protective equipment, PPE. And this is equipment that, an N95 mask, the eye protection, a shield, an eye shield, a gown, gloves, etc. And they have to be in a room that you can then, after the test, take offline for a couple of hours and decontaminate it, disinfect. So this is not simply just walking up to the doctor's office and getting a swab like you would for a strep test. This is a much more complex test. It takes quite a bit of equipment and staffing and time. So we are gearing up all of our hospitals, and I believe other health systems, hospitals as well, are gearing up to have testing locations, testing sites where people can go. We also want to make sure that when people go for a test for COVID-19, that they call ahead, that they get an appointment for that, so that we're expecting them and we can provide them the care they need, and also make sure that the possible infection is not spread to others. So for instance, instead of having somebody who is coming in for a test just walk through the waiting room, we are trying to bring them in through a separate entrance, sometimes a separate area, a separate building even, so that we can make sure that they have their own set of professionals who are helping to take care of them and test them in a separate place from other care. So that we do have some of those sites up and running. We ask that people not show up at Nordics Labs or these Maine CDC lab. They are not equipped to actually take the test. They actually perform the test on the sample, but they're not there to actually take the swab from the patient. So, so we ask that people call their doctor if they feel like they need a test, and we are providing that test. And we are working very closely. Our Nordics laboratories, our healthcare professionals are working very closely with Maine CDC and the Maine CDC lab to make sure we can expand our testing capacity very rapidly, as is already happening this last few days.
Is 1,000 tests enough, and do you expect to get more?
We do expect that we will require more test kits in the state of Maine, as other state health departments across the country will as well. What we are doing right now is working with the US CDC to make sure we put our order for any subsequent test kits in now, so that we don't have any discontinuities or interruptions in testing.
Now, the press release said this morning 3 presumptive positive cases. Can you just explain that again? Now it's only 2.
Correct. As of right now. So again, in an effort to be as transparent as possible and level with everyone in Maine about what we know and when we know it, we announced this morning, in addition to yesterday's, we announced that were 2, and I hate to go into more terms, but we announced were 2 preliminarily presumptively positive individuals, in addition to yesterday's. And one of those 2 that we announced this morning, we are moving from the preliminarily presumptively positive box to the officially presumptively positive box. The other, we're still reviewing.
And I can just say, too, that this is not uncommon. This is a new virus. It is a new test. It's a new test across the world. And this has happened actually a number of times across the world, where something may look like it's a positive test or a negative, or a positive test, and then when it's repeated, it may come out a little bit differently. So we are working very closely together and making sure that US CDC will be able to confirm and clarify what the actual test results are.
Do we know how this individual moved into the healthcare system? Like, did they just kind of come into the doctor's office? Did they call ahead?
Is this the one from yesterday?
Yes.
So what I can tell you is that this individual was incredibly responsible and responsive to requests from Maine CDC. When this individual, recognizing that she was returning from a country.
Oh, I'm sorry. I mean, yeah, the second.
The second, got it. That investigation is underway right now. Again, our epidemiologists are working on that. As with yesterday, step 1 in our process is to confirm where we are with the laboratory testing, and then our team of epidemiologists jumps into action to start working with the individual. That process is literally happening right now.
Are you concerned about this weekend being St. Patrick's Day weekend, and or people coming from out of state who may be in a more coronavirus-prone area coming up here?
It's
College students.
It's a concern. I think one reason we wanted, among many, that we wanted to make the announcement yesterday to recommend limitations on large, non-essential indoor gatherings was to start getting that message out sooner rather than later. But it is a concern. That being said, travel of that sort is commonplace, and so, that's viruses don't respect borders. But it is a concern.
On the number of test kits, because there's a lot of concern about that. So we were given 1,000 tests. What Maine Health is doing, are they using those same tests, or do you guys have additional capacity beyond the 1,000?
Good question.
It's a different form of the test. So it's not the same test kit that US CDC has been distributing. It's a different type of test kit that some other states are using. And again, these are all new tests, so that's why we're being extra cautious and making sure that all these tests across the country are being double-checked by US CDC. But it does expand our capacity quite a bit especially over the next few days as we ramp up at Nordex as well as at Maine CDC.
And that's the key. It's an addition, it's an augmentation to our state's overall testing capacity, not a subtraction from it. In addition, the source of the tests that hospital systems like Maine Health obtain their test kits is different from the US CDC, which again means by Nordex going online with a test kit, they are not taking anything away.
That's right.
Can you clarify also just about where people should get tested? We're hearing that people should get it tested at their primary care office, but it's complicated. They may not have protective equipment. Hospitals are setting up satellite locations. Like, what are we moving towards? More of these satellite locations and at
Yep.
hospitals?
So I think that's a great question, Patty. We still recommend that where possible, individuals obtain testing through their primary care doctor for a number of reasons, not least of which is that if you're not feeling well, you should check in with your doctor. The other change that is happening at the national level that I hope will alleviate or may help will help with some of the testing is just in the past 36 hours or so, the US CDC has changed some of the recommendations really, for what type of personal protective equipment folks need to have on when they are working with patients who they believe who may have COVID-19. They didn't change them entirely, but they did make allowances for facilities that may not have these N95 masks and make allowances recognizing that standard surgical masks may be sufficient. With that change, we are hoping that additional practices also come online. We actually issued an alert to all Maine physicians and healthcare systems to make sure they were aware of this change. I'm going to turn things over to Dr. Mills for a discussion on other testing sites.
Yeah. So we are hoping that official change happens very soon because it will help a great deal to reduce the barriers to testing. We also, as being a very large health system, Maine Health being with 10 hospitals, we are trying to also centralize some of our testing so that people can come in and be seen by a provider and get the test, but not have to sit in the waiting room of a busy primary care practice and possibly spread the virus to others. So we are all trying to dealing with this in different ways, and if it's and trying to figure out what makes the most sense given each community's needs.
That would be something like a tent, maybe outside?
So tents are the alternative care sites and testing sites through the use of tents and other buildings that are available is something that's in the pandemic plan, and that is something that all the hospitals I know of in the state of Maine are working on, including those at Maine Health. We are starting to set those up. You might have seen some of them actually in the last several days, and that's part of the plan that will help with testing, but also with providing alternative care as this infection spreads. We do expect, as Dr. Shaw has mentioned, when you see the very rapid progress of this expansion of this virus across the country and across Europe over the last, especially week or two, we are ramping up to make sure that we are available to take care of people as we expect more people to have symptoms.
The patient at Maine Med, how's she doing? How's she doing, the patient at Maine Med? And also, who's confirming that test? The US CDC or the Maine CDC or both?
the US CDC. And because of privacy issues, I am unable to share any information about individual patients.
The man in his 50s, is he at home and did he call his doctor when he wasn't feeling well?
I can't speak to the latter, but we can say that that individual is at home. Just to be clear, this is the second case. Yeah, I just want to make sure. Yeah, so the man in his 50s is at home.
The woman from Italy.
Whether those two cases are connected at all?
Always one of the questions we ask when we do these epidemiological investigations. In effect, where have you been in the last 14 days? Whereas everywhere you visited, everywhere you've eaten, everywhere you've stopped, as you can imagine, it's very difficult to have those memories recalled. We ask people to look at their credit card statements, their social media, their Yelp check-ins, things of that nature. It just gives you a bit of a flavor for how difficult these epidemiological investigations are. That's why I'm so proud of our disease detectives, because this is really difficult. Then matching all of those things up with potential exposure timelines when someone may have been infectious, and matching all of those things up to look for one commonality, it's like finding a particular needle in a stack of needles.
So it sounds like we don't know yet.
Not at this time.
Can you say when the woman from Italy, the woman who's in Italy, when she returned, how many people she lives with, and what base she was deployed at in Italy?
I don't know the latter one, and for the former two, we wouldn't release that information.
Can you
Sorry.
talk about the criteria that somebody must meet to be eligible to get a test?
Right. So, Dr. Mill, I can start. Right now, the US CDC criteria are that a physician believes they need to be tested based on their exposures and that they have symptoms.
And, excuse me, for most healthcare providers in Maine, what we're feeling is that because of the local epidemiology, which is what the US CDC says to take into account, where we don't have any evidence yet of community spread, that we're staying pretty much with the criteria of the, if somebody has the symptoms of a cough, fever, or shortness of breath, and they have traveled from a place where there have been outbreaks, significant outbreaks, and that is a list that continues to expand, including Boston and New York, or they have been exposed to somebody, in close contact with somebody who has known COVID infection. Or if there's somebody who's very seriously ill for whom the cause is unknown. And then we also are saying, if as a provider, as a physician, you feel strongly that this patient needs to be tested, then that certainly we want to leave it up to our physicians and other healthcare professionals to use their professional judgment. But because the testing itself is the testing kits just have come up online here in Maine, and because it does use quite a bit of the personal protection equipment, we have adequate supplies right now of that, but we want to ensure that we maintain adequate supplies of our personal protection equipment, particularly as this virus may ramp up here. So we are just being a little bit judicious because of wanting to protect that equipment and the testing kits, and making sure that we're getting the tests, we're getting people who are tested who need to be tested. I should also mention that the criteria are evolving as we speak. I mean, every day it seems like we add another word or two to kind of loosen it up, because we want to make sure that we're testing who needs to be tested, and especially as our testing sites ramp up and the testing equipment and kits ramp up. But we are in, I think, this narrowing window where we also, I just want to go back to the social distancing that Dr. Shaw talked so well about. We seem to be in this narrowing window of opportunity to make sure to take all those steps that Dr. Shaw mentioned, making sure, particularly if you are an older person or somebody with a serious chronic medical condition, that you are staying away from groups of 10 or more people, that you are not traveling, you are staying at home for the most part, you're not getting on a plane or a cruise ship, that you are really keeping safe, and that if you are not in those groups, that you also have used social distancing and vigilant respiratory hygiene, and call upon those people, those loved ones, neighbors, family members who do fit into those high-risk categories, and make sure that they're okay. as Dr. Shaw so well said, we can do social distancing, but not social isolation.
We're a large rural state. Are these tests available around the state? Say if someone, from Jackson or a rural area, are those tests going to be available in their area?
So again, the test is conducted at a laboratory in Augusta or down in Portland. What a physician needs to do is collect the specimens, what a physician needs to do is collect the specimens. And that can be done by a swab and then placing it in a transport media and then shipped to our lab. So the tests are available where physicians are.
Dr. Shaw, can you give us some insight into what the process is, if any, for people who have been traveling abroad that are re-entering the state?
Great. So the answer is yes, I can, but buckle in. Okay, so if someone is, and this guidance, the reason I say that is because the guidance changes every 12 hours or so as we learn more and more. That's the nature of science. That's the nature of working in an outbreak situation. As of right now, if an individual is returning from a level 2 or level 3 country, which is to say Italy, South Korea, Iran, China, that individual is asked to remain in self-quarantine for 14 days. If that individual develops symptoms during that time period, they are urged to call their doctor's office first, and then testing will be arranged for. But that is changing very, very quickly. As the outbreak spreads into other countries, the nature of that guidance can and will change. So we urge everyone to take a look at travel guidance before you travel.
Dr. Shaw, later this afternoon, President Trump is reportedly going to declare a national emergency. How does that affect us here in Maine?
We'd have to see what the particulars of the declaration will be under the Stafford Act. It's something that we have been thinking about already as part of our preparation. As you're aware, Secretary Azar declared a public health emergency under his powers at DHHS on January 31st. So the President's declaration, depending on what happens, can't speculate, but will amplify those. The extent to which that will liberalize certain things or change our operations, we really will have to evaluate the particulars of what is in that declaration.
If somebody has an elderly or vulnerable relative in another part of the country, maybe they're down south for the winter or something like that, and they are thinking about bringing them back here, should they do that or not?
You just described my mother. No exaggeration. My mother lives in a home, an independent living facility down in Houston, Texas, and she spends the colder parts of the year there. We are planning on bringing her back up here in early April, was the plan. She's coming back on Sunday.
Do we know, or are you able to share with us how many people the state has either requested self-quarantine or has advised that they should self-quarantine?
We can share that. I don't have the number with you right now. We can get that number for you. Yeah, I don't want to give you an incorrect number. The reason I looked quizzically is that it's a really important distinction, is the distinction between quarantine and isolation. You may have stumbled upon it, but if not, just to recap, quarantine is the separation of an individual who does not have symptoms yet, but who we believe to have been exposed. That's a rather large group of people. Isolation, by contrast, is the separation of an individual who has not only been exposed, but is showing symptoms as well. That's a subset sometimes of individuals who have been quarantined. We are obviously keeping track of both. Both are an extremely fluid number. Folks come into isolation, folks come into quarantine, then they leave quarantine. So the number we have may be approximations because they change quite frequently. But it's something we obviously track. And I have no objections to sharing it.
Okay, good.
Got about 2 minutes, because
I
I'm.
know you said it's protocol to only release the counties, but don't you think people should know what town?
We have a balance. We've got a balance between making sure that individuals in Maine know what's going on in their neighborhoods, in their counties, in their area, as well as protecting individuals' privacy. The determination that we've made and the determination that most every state has made is that county level disclosure appropriately balances those two. The risk is not so particularized that knowing anything below the county level should change behavior. We should all be taking the steps that we've been talking about at these briefings for several days now. Staying healthy, looking after your neighbors, practicing social distancing. Everyone should be taking those steps irrespective of what's going on around them.
What's your advice to Mainers about personal travel, whether that's on vacations, flying? People are worried about that. 46 states have positive cases. Obviously, we now have some. What's your advice about personal travel, and what's your opinion on what schools should be doing here in Maine? They're all pretty much still open.
Great. With respect to personal travel, my advice is twofold. First, please take a look at the US CDC's website or that of the US State Department before traveling anywhere. Those websites pertain to international travel. Now, with respect to domestic travel, specifically airline flights, I say this again based on personal experience right now. I urge everyone to take a look at their travel plans, especially if they or a loved one they know is over the age of 60 and or has chronic medical conditions. It's a balance. If someone were quite elderly and had a number of medical conditions, even something as simple as a flight may not be warranted or indicated at this time. Someone were very young with no medical conditions, it may be okay. Can't give any hard and fast rules, and it's something of a sliding scale, taking into account a number of other factors, but I think everyone should be thinking about those things very intently right now.
And schools, sir?
Schools.
Weigh in on schools?
So schools are under discussion right now. Similarly, with many of the other things we've talked about, there's a balance. And so that's a discussion that's underway right now.
At least one hospital's low on supplies, at least one hospital's low on supplies, how's Maine Health doing on supplies? And also, can you both of you talk about the run on toilet paper and hand sanitizer and everything like that?
Maine Health has adequate supplies. We are being judicious with them because we understand that upstream, with some of them being made in China, that the Chinese factories are not yet back online. So we're being judicious, but we have adequate supplies. What was your other?
The run on toilet paper.
Oh, the run on toilet. Well, I did miss the rush and went too late to do my own stockpile, but I went to this grocery store last Sunday evening and found everything I needed except for hand sanitizer. So, and there was plenty of paper towels and toilet paper. So I think there's a lot of variability right now. I didn't buy lots of it. I just figured there's going to be, I mean, I don't have much room in my condo, my apartment anyway. So, but I do have some, and I think it's wise to be stockpiled, have some stockpile of it, but not overdoing it. And I think,
Yes.
yeah.
Thanks, everyone.
Thank you.
921 calls, 211 in the last 24 hours.
Yep, should have mentioned that, yep. 921 calls to 211
That's just calls, that's
since,
not text or
And
email.
those are calls that come into this building?
to the 211 building.
But are they answered? Oh, that's different.
Yep.
So 921 calls in the last 24 hours, that's just calls, that's excluding text and emails. So, unless there is a major development, the next availability with Dr. Shah will be Monday. I will send information out. If there is a major development over the weekend, we will let you know and give you advance notice, okay? And I know some of you are waiting for information on other things. I hope that it's...
You were just watching the daily briefing from the Maine CDC and Dr. Dora Mills of Maine Health. A couple of things to recap here. We have 2 presumptive positive cases in Maine. One, in addition to that, is preliminary presumptive positive. The 2 presumptive positive cases, a male in his 50s from Cumberland County and a woman from Androscoggin County. Dr. Dora Mills calls this a rapidly evolving situation. The state is capable of testing 1,000 cases. So far, they have had 91 negative, 17 are pending, 2 are presumptive positive. Obtaining that sample is best to do through your primary care doctor. Officials are asking you not to just show up at the emergency room, but call ahead, work with your primary care physician. If you do not have a primary care doctor, reach out to an urgent care clinic, but again, call ahead of time. They aren't conducting the the test kits there at the doctor's office. They're taking a sample from your nose or from the back of your throat, and then those samples are sent to two state labs that we have here. Again, the state is capable of doing 1,000 tests at this time. 91 have returned negative. Testing sites are being established, and this, again, as Dr. Dora Mills said, is a rapidly evolving situation. We learned earlier today that the Maine Principals Association has suspended spring sports until April 27th. Again, if you feel like you have symptoms, you're going to want to reach out to your primary care doctor. And when you talk to your doctor, they're not only going to ask you about your symptoms, but they're also going to take into effect your exposures, where you may have traveled recently. There have been 921 calls to the 211 information hotline as of right now. Again, you can call 211 for any information about COVID-19 in Maine. In regards to travel, Dr. Shaw suggests everyone closely monitor the CDC Travel's website, especially for international travel. As far as domestic travel, he says to take a close look at your plans and reevaluate if you're going to be around anybody who may be at risk. Again, that is all we have from the Friday, March 13th update from the Maine CDC and Maine Health. Stay with us on air and online, and we'll see you back here at 5 o'clock.
Thank you.